HealthWish is a series of conversations about the state of healthcare in New York City's fabulous fifth borough, Staten Island. Our goal is to raise issues, raise awareness, and raise health, because when we raise health, we raise everyone. Today, we are with Directors of Community Health at Staten Island University Hospital, nurses Frank Morisano and Claudette Hill, to discuss the social determinants of health. The community health team at Staten Island University Hospital is changing things up. Meet them and learn how they are helping to tackle issues like food insecurity, better access to health care, and crime in the neighborhood. Special bonus, learn about their unique Community Day of Surprises for patients. Give it a listen.
Hi everybody, my name's Frank Morisano. I'm Senior Director of Community Health at Staten Island University Hospital, and I'm here with my friend and colleague Claudette Hill, Administrative Director of Community Health. Good morning, Claudette. So we're here to talk about the importance of community health on Staten Island and what we do and how we raise health on Staten Island.
The social determinants of health are really crime in the neighborhood, access to health care, access to education, and some neighborhoods, unfortunately, are negatively impacted. And in our roles, we have a phenomenal team. We have a retired principal, a retired fireman. We have a bishop. We have Jacqueline, who's an educator. We have Sadiqa, one of the nurses. So this team has been put together and we're doing some phenomenal things. We're doing faith-based health screenings at the faith-based organizations twice a month. We are also raising health by giving community residents healthy, fresh fruits and vegetables with our Clementine Collective that we have in several stores in Staten Island. And with the Clementine Collective, we have the fresh fruits and vegetables in store. We have healthy eating tips, healthy recipes. One of our biggest accomplishments, I think, for 2022 has been the pop-up pantries that we're doing at the schools, and we listened to their concerns, and we started these pop-up pantries in which we supply the schools with 15 bags of shelf-stable food and 15 bags of fruits and vegetables, along with the recipe book, along with food resource cards.
Claudette, the work we're doing in the community is just outstanding. Just a couple of follow-up questions. On the Clementine Collective, how many delis are we in on Staten Island?
So we're currently in 4 delis, 2 in Mariners Harbor, 1 in Stapleton, and 1 in New Brighton.
And the response we've gotten from the public?
And they've told us about different fruits and vegetables that they would like, and they've also mentioned other stores that they feel that we should get into. So
we do a lot of listening tours and programs in the community. Where did the idea for the Clementine Collective grow out of on Staten Island?
Every year since 2020, Dr. Ardolik has had a North Shore Summit in which we go to the North Shore, we pick a venue, and basically he lays out his vision for healthcare for the North Shore of Staten Island. And one of the community residents stood up and said, you know, they live in food deserts, basically, some people. They don't have access to the big stores, and they shop in their local bodegas that do not have fresh fruits and vegetables. And what could Staten Island University Hospital do to make a positive impact? So we took that as an action item, and we collaborated with one of our community partners, Heather Butts, who is the co-founder for Health for Youth. And Heather already had a Clementine Collective in one of the stores on Jersey Street. We had our very first store, which was Columbia Meat Market, and we've been in Columbia Meat Market well over a year, and it has been a huge success.
And talking about the pop-up pantries in the public schools on Staten Island, we give out bags of food. How many families have we touched in 2022 with this pop-up pantry program?
So we've touched 277 family members. And we've given out a total of 2,900 pounds of food, and we've received some good feedback from them.
So part of our social determinants of health, and you mentioned it previously, is we deal with violence on Staten Island. It really affects a lot of families, and unfortunately Staten Island is not immune to that. Tell us about the work you've been doing with the DA.
So over the summer of 2022, our team was fortunate to have an executive health intern, Ananda, and Ananda created a community health needs assessment, and she surveyed 52 community residents, and their biggest concern was food insecurity and crime in the neighborhoods that they lived in. And she met with DA McMahon, who gave her a lot of information about what the DA's office is doing regarding violence. And she put together this resource card with information about True to Life, the DA's office and what they're doing, and about domestic violence.
All the community benefit that we do on Staten Island it's a pretty staggering number. We hold about 600 events a year and we touch 31,000 people, which means that we've helped, educated, fed, protected 31,000 people on Staten Island doing what we do. Our footprint is all over Staten Island. The social determinant of health are really our core business, but we do other things on Staten Island. Tell us about the pipeline programs that community health is a part of at SIUH.
We have 2 pipeline programs that we're invested in. The Executive Health Internship, which is a program for juniors and seniors in college that are excelling. They come into the hospital for the summer. They work closely with administration, and they are paired with mentors in different departments, and it happens to be a paid internship. We also have the EMT program, which the ages are 17 plus, and we have 10 scholarships every year. And this EMT program, once they graduate, they take the New York State licensing test, and they can work as EMTs anywhere on the island or anywhere in the city.
So far, we're on our 3rd class in, which is 10 EMTs per 10 people per class. Out of the 20 that applied to the program the last 2 years, we graduated about 15 of them, which is way above the national average for EMT graduates. So we really are affecting people on Staten Island with that program. So we work with Joe Conti and the SIPPS on pipeline programs too. Tell us a little bit about the programs we work with him.
So the community health worker is a program that we normally have over the summer as well. And it's a group of young people that are interested in working in the community, providing community service. And we do a training, and they rotate through each community organization for 2 weeks at a time. And they really get a feel on what each community organization is doing for the residents of Staten Island.
And the purpose of these pipeline programs are twofold. One is we want to give opportunity to our youth and our young adults on Staten Island. And second is we want to keep the best of the best on Staten Island. And once we get someone in, as you said, we have Dementorship programs, and you're a prime example of that story. Tell us how you started at the hospital and how you got to this point where you're the leader in community health.
I started out in a hospital 24 years ago, working in outreach services. I was a file clerk, basically. And at that time, Anthony Ferreri was the CEO of the hospital. And he implemented this program where he took 25 employees, and we went into a nursing program at the College of Staten Island. And after graduating, I started out as a nurse in the emergency room, which you were our AVP at that time. And it was hard work. I learned more than I ever thought that I would learn, and it was just so fulfilling.
So during your climb or your evolution at Staten Island University Hospital, you worked in case management. Tell us about the Day of Surprises program that blossomed while you were a manager in case management.
So being a manager in case management, you're up on the floor and you're rounding. You're getting report basically on your patients. And we had a patient that the social workers were telling me was increasingly becoming depressed and not eating, a young man that was really facing his mortality. And I just wanted to do something to kind of cheer him up. And so we found out his favorite meal. We had the chef create pepper steak and rice for him. He ate food for the first time in a few days. And I didn't want him to think that we felt sorry for him. So we said, let's just do a week of surprises. And every day we'll give him, something small to cheer him up. The second day, we gave him a Bluetooth speaker. And now Wednesday is approaching and we don't have anything that we're planned. I knew he was listening to rap music, so I made the joke we needed to get a rapper there. And they all laughed and said, Claudette, you're crazy. I called a friend of mine. I reached out and was able to get Method Man to come to the hospital. And boy, did he brighten up Bryson's day.
Now, from my perspective, it was like, I'm just going to cheer somebody up really fast. But it turned into, he helped me, you know, because I'm sitting here and the magnitude of the moment happened to hit me, and it was like, you could tell that he was sick, but you could see there was a certain strength there that didn't want to give up. Knowing, you know, his plight, how he's in the hospital and no family members are checking for him, and he's pretty much by himself, broke my heart. By the time I left that establishment, I felt more enlightened. He kind of brought something out of me that I didn't even know was still there. You know, I can't even describe it. I would like to put a word on it, but every now and then I think about the guy. He's passed on since. And then you start to count your own blessings. Like, you people have no idea how lucky you are that you even woke up this morning, you know, and can complain, have a voice.
After seeing the impact that had on him, I knew then that this was something we needed to do for our patients. It didn't have to be a week. It could just be a day. You give them something they like, a crocheted blanket so that they could be warm, a blueberry muffin, a comic book. You know, you just make them feel like they're the most important person in the hospital that day.
HealthWish wishes to thank our very special guest, nurses Frank Morisano and Claudette Hill. We're very interested in your HealthWish. Contact us at healthwish@northwell.edu. Thanks for joining us. We hope to see you again soon.